Good afternoon, friends. Dr. Abdul Khaliq here, medical gastroenterologist from Hyderabad, as well as CEO of Umdaa Healthcare. Today I will be discussing about the topic of how to reduce mishaps in hospitals or clinics, particularly because of the misunderstanding of the patients or their attendants causing nuisance in the hospitals or the clinics. It's a very long topic. I'll be discussing a few points today and a few points during my next series of videos. Let us be clear from doctor's point of view that the word trust between the patient and their families and doctors is not as much as it used to be around 3 or 4 decades earlier. Now patients see doctors with an eye of suspicion, and doctors also practice medicine with a word of caution. So the word trust is hardly present in this present era of medical practice, and we should be aware of this ground reality. In business and management language, there is a principle by name Pareto Principle, which says that out of 100 cases, 20 cases will bring in a lot of revenue. These are the 20 cases wherein you need to focus. Applying this Pareto Principle to the mishaps of healthcare, I think that around 20% of the patients, whatever good we try to do, will not be satisfied with our services or with our management. This 20% may seem larger for you, but most of the people will not come forward and speak because of their concerns that if they speak out, the management of their patient may go wrong, or doctor may keep that word within his heart and may not manage their patients in a good way. That's why most of the patients who are not satisfied also may not come upfront and say that they are not satisfied. Very few people will be coming upfront and saying that they are not satisfied. So I feel that approximately 20% of the patients, in spite of our best efforts, may not be satisfied with us. So we should also keep it in mind that when compared to a person versus process wins most of the time rather than a person. See, however good I may be in the treatment, however good I may be in the counseling, but if there is a set protocol and processes of how I should treat, and set protocol and processes of how I and my team should be communicating, the processes will win in most of the time. So always our energy, time should go in making the protocols as well as the processes of each and every step, as well as in refining them. So to decrease the mishaps or unwanted things within the clinics or the hospital, I propose 3 points or 3 areas where we should be working. First thing is setting the expectation right for the patient and their attendants. The second point is transparency both in the treatment as well as transparency in the billing. Third thing is communication. Out of these 3, I will be discussing about the first point, that is setting the expectations right. So whoever the patient or the attendants comes to the clinic or to the hospitals for admission or for procedures or for surgery, we should make an effort to make their expectations right. These expectations can be broadly divided into 2. One is expectations from the treatment per se. Second one is expectations from the ancillary things. In both the things, the expectations has to be right. Coming to the treatment of the expectation of the treatment, a few questions should be answered in our protocols. First thing is, who is going to speak about the treatment or counseling? For example, in my OPD, I give counseling to the patients, and the treatment part I have delegated to one of my juniors and supporting staff. So she explains to the patient what are the tablets to be taken, how they have to be taken, and she clears by sitting around them. So I tend to save some time rather than explaining what medicine how to take. Rather than explaining that one, I will be spending a lot of time in explaining to them regarding the counselings and the other aspects of the management, rather than saying this tablet has to be taken in the morning, in the night, before food, after food, etc. So who is going to counsel? you, your juniors, your team members, your colleagues has to be set right very clearly. So the people who has to counsel only has to counsel, and what they have to counsel is also quite important. Second thing is when to counsel. This is also quite important because the expectation of the patient or the attendants has to be met in. Sometimes if I go to the round early in the morning, sometimes I go to the round after finishing my procedures, sometimes I'm going to the round in the evening. That makes them completely unpredictable about our counseling. So the timing of the counselings, whether in the round or in the OPD or in the ICU, has to be in and around fixed, nearly fixed, and we should try to stick on to those timings so that their expectations will be right. Third important aspect of counseling is where are we counseling. So always determine the place where we are counseling. If in the rounds in the wards, we can counsel by the bedside, but if the case is important, or if we are doing procedures, or if the patient is sick, then there should be separate counseling rooms with a very good audio visual recording system wherein the counseling has to be done. Fourth thing is, what are we counseling? In counseling, we should be knowing what we should be counseling, that is the treatment aspect and their expectations of the treatment and a possible outcome. But we should also know more than that. One is what we should not counsel. We should not be counseling about lack of parking. We should not be counseling much about the rude behavior by a staff. We should not be counseling about non-availability of medication. For that, we need to say that we are doctors and there is a separate staff or separate administrator, and we should facilitate the meeting of the patient or the attendants with the staff or the administrator who addresses these issues. If we start counseling all the ancillary things, then the patient or the attendants may see it as a total package of the doctor rather than of the hospital. The last thing about the counseling is how we should counsel. Most important is whatever be my mood, whether I am irritated, angry or this thing, before counseling of the patient, whatever be the silly questions put in by the patient, always I should transform into a peaceful person, probably into a Buddha-like person with a patience, listen to them and counsel them in the best possible way. So these are a few things that we should be keeping our expectations right about the counseling. The second aspect of which the expectations should be kept right are about the ancillary things. Where to park, where is the canteen, where is the place to stay in the IPD cases, when is the time to meet to the doctor, where are the medications available, where they have to go and address if they have any concerns. All these things has to be made into a small booklet or a video and has to be given to the patient and attendants. If such a type of protocols are done and we make the expectations absolutely right for the patients, then the chances of occurring of mishaps will be low. Thank you.